Benzodiazepines are a class of drugs that include Xanax, Valium, and Ativan. These types of medications are usually prescribed for those who are experiencing anxiety. If your loved one has become addicted to prescription benzodiazepines, you must take action. The benzodiazepine detox process can be fatal. Your loved one needs to get to a safe treatment center where they can fully come off of this medication under medical supervision. Staging an intervention can make that happen. If you think that your loved one is abusing benzos but aren't sure, you can spot the signs if you know what to look for. The most prominent signs are drowsiness, slurred speech, frequent loss of train of thought, falling asleep while standing, and just acting out of it. Benzos are frequently used in combination with other drugs, so there may be additional signs displayed. Users carry a high risk of overdose when mixing benzos with other drugs. Studies show that successful recovery is directly related to early intervention and treatment. Families sometimes take a step back from trying to intervene, hoping for things to get better, and this is one of the worst things that can possibly happen. Usually when families call us, they often want to know how effective intervention is. We will be the first to tell you that the success of the intervention ultimately depends on the ability of your family to come together in agreement and unity. This agreement is that each family member will do everything in their power to stick to any boundaries that you decide to set with your loved one. Don't wait to stage an intervention. You need to intervene as early as you can and start to gain an understanding about the disease of addiction. If you understand fully how addiction works, you will realize why you can no longer leave your loved one to their own destruction. Addiction rewrites the survival centers of the brain, and this is how they get to the point where they are willing to obtain the drug at any cost. These brain changes are serious, and your loved one is not in any place to be making their own decisions about treatment. Our interventionist will make sure that you have the best evidence-based information on addiction and intervention. Understanding that every family is unique, our interventionists do not use a one-size-fits-all approach to intervention. The intervention process will be tailored in a way that will be most effective with the loved one's personality and history. Or sometimes, if the addict finds out that an intervention is being considered, they will step in and promise anything to stop it, and families will believe them. Families also sometimes attempt to stage the intervention on their own. Holding your own intervention is highly unrecommended. Interventions that include a professional interventionist always have a higher rate of success. If you still aren't sure about an intervention, just give us a call at 1-877-245-2384. We can answer any and all questions that you may have about the process. On behalf of Addiction Care Recovery Services, thank you for watching.